Evidence-Based Urgent Care from EB Medicine. Hello, my name is Patrick O'Malley. I'm a board-certified emergency physician and creator of the Laceration course. I completed my residency in Charlotte, North Carolina at Carolinas Medical Center and have spent the past 15 years working in a variety of community emergency department and urgent care clinics. I'm on the board of directors for the College of Urgent Care Medicine, and I am very excited to partner with EB Medicine. What is EB Medicine? Well, first of all, EB Medicine stands for Evidence-Based Medicine, and they really have set the standard for emergency medicine continuing medical education content and have been doing so for over 20 years. They launched their flagship journal, EM Practice, and then brought pediatric EM Practice. They're bringing that same commitment to quality to the urgent care space with the release of Evidence-Based Urgent Care. Each month, you will receive a highly referenced, peer-reviewed deep dive into a single topic. Each month will provide practical, real-world, applicable recommendations that you can apply to your practice and improve patient care. Evidence-Based Urgent Care comes as a digital format that can be downloaded and printed off, but each month is going to have a concise, easy-to-use format that informs you, keeps you up to date, and allows you to bring evidence-based principles to your practice. On a daily basis, we're speaking with medical directors, chief medical officers of large urgent care groups, and seen here on this screen are some of the feedback and the comments that we get from them. These are the same issues that everybody across the country in the urgent care space are dealing with. They're aggravated by the high cost of CME. They're frustrated with having to refer patients away because their clinicians aren't comfortable managing patients in the urgent care setting. They feel that onboarding is a major challenge. We've got so many new graduates that are coming in, many of whom who have never worked clinically, much less working in urgent care. And our content, Evidence-Based Urgent Care, allows them to standardize the onboarding process and take that administrative frustration and struggle of creating new content every month and being able to provide that to your clinicians to get them all on the same page quickly. They want to be able to standardize the quality of care that everybody is going to receive, regardless of which clinic they're going into and who is seeing them. Many of these medical directors are pressed for time. They don't have the ability to go through and create high-quality content on a monthly basis to keep their clinicians up to speed, practicing evidence-based medicine in an efficient manner. We also hear that whenever a clinician needs remediation, that maybe they've had a bad outcome or they really need some focused, dedicated work, many of our partners want to have a vetted, trusted source to be able to provide that education so that that will address some of the medico-legal risks associated with remediation. So what comes in an issue of evidence-based urgent care? Well, you can see some of the aspects right here. Each issue will have clinical pathways to help guide decision-making. There are charting tips that will help improve reimbursement. There are going to be practical guidance for reducing risk. We want to give you those resources so that you can address some of the medico-legal concerns and minimize the medico-legal exposure and risk for your team. As with their emergency medicine content, the same type of format will be seen here in evidence-based urgent care. There's information about the pathophysiology, the physical exam, diagnostic testing, and disposition. Interestingly, this is all specific to urgent care. So much of the medical education that we have for urgent care has been based on emergency medicine or family practice. And I think we can all understand and appreciate that urgent care is a different, it's a different practice environment, and there are specific things to urgent care that these other practice environments, emergency department and family practice office, are not applicable in the urgent care setting. And evidence-based urgent care is really the first of its kind to take this into account and really provide targeted, focused clinical education specific to urgent care. There's also links to MD Calc's clinical decision rules and risk scores, and there's even some fun things, some brain teasers and pearls to really keep you engaged as a learner. Clinical pathways are important, and a clinical pathway is included in each issue of evidence-based urgent care. It's basically an evidence-based algorithm to help guide decision making. The beauty of these is that these can be integrated across your entire network of clinicians so that you know that everybody should be practicing in the same manner. At the bottom, you'll see that there is class of evidence ratings to show the quality of the evidence included in each pathway. They're easy to interpret and, again, can be shared with everybody on your team so that you know that everybody is going to be practicing in the same manner. Pitfalls. As clinicians, one of the main things that really keeps us up at night is the concern about being sued, about getting into some kind of a medico-legal scenario due to something that we did or did not do. Another really important aspect of evidence-based urgent care is that we include risk management pitfalls for each topic. And these help avoid common errors in diagnosis and management. And the goal here is to reduce your medico-legal risk. So each issue of evidence-based urgent care has a section on how you as a medical director can help guide your clinicians in a way to reduce that medico-legal risk. Charting tips. Every year, urgent care clinics leave tens of thousands of dollars on the table because of improper billing and coding. Each issue of evidence-based urgent care has a specific section dedicated to the billing and coding aspects of that particular clinical scenario that the issue is focused on. What we want to do is help your clinicians understand the proper documentation requirements so that they can maximize their reimbursement and not leave any of that money on the table every month. We want to help you get full reimbursement for the services that you provide. And having this dedicated charting and coding information will really help your clinicians get up to speed, knowing what they need to include in their documentation to improve that reimbursement. What's included when you and your team members have access to evidence-based urgent care? I'm not going to read everything here on this slide. You can read some of this stuff for yourself. You are able to get a sample if you follow the URL in the right upper corner here. I think some of the main, most important points here are that it's accessible online, also through EB Medicine's app, which I use myself. It's fantastic, very easy to use. Each issue comes with 4 CME credits, and there are some bonus issues so that you can get 50 or more CME credits a year. We are able to arrange for reporting to the medical director so that you have some valuable insight into who is accessing the content, how often they're logging in, and how many hours of credit they are getting. You will have a dedicated account manager that you can reach out to, who can answer any questions, who can provide those reports to you. Whenever your team members sign up, you also get access to the previous issues, and that's very important because that's where the onboarding education, the content that can be utilized for onboarding comes from, and we'll get to that on the next slide. Evidence-based urgent care has been out for roughly a year. This is January of 2023, and here are the topics that have currently been released, and you can see the ones that are available now. This is just kind of the who's who of what we are seeing in the urgent care setting. And some of the upcoming issues will be able to continue to address the things that we commonly see in the urgent care setting. So again, what I mentioned previously, this is a great way to be able to streamline your onboarding process and take some of that burden off of your shoulders for creating that new content. It's already done for you. It's here. It's high quality, evidence-based clinical education and content. And again, it comes with CME credit. Anything that you are creating on a monthly basis, not only does it take time, valuable time away from you focusing on other aspects of your job, but whatever it is that you're creating doesn't come with CME content. So this is another bonus of being able to integrate this content into your onboarding and ongoing training process. So great menu of topics that have already been released, and on a monthly basis, a new topic is coming out. We're always open to end user feedback. Is there a topic of interest to you? You can submit that over, and that's something that we can take a look at and review and consider for future publication. Here are just some of the feedback that we are getting from our customers, and you can read these here, but on a variety of different topics. We hear from so many people that just how evidence-based urgent care has impacted not only individual clinicians, but from an organizational standpoint. The ability to take that administrative burden of creating new content every month, it's really reinventing the wheel, and we want to be able to take that off of your hands. The feedback from individual clinicians is fantastic, really changing people's practice. There's a lot of other resources that are available really for point of care, for a single clinical question that may come up, medication dosage and things like that. But what evidence-based urgent care does, it really is providing more of a global fund of knowledge. Although you can go in and ask a specific question and find a specific answer for something, at the point of care, evidence-based urgent care is really aimed to increase the overall fund of knowledge. There's a lot of urgent care clinicians. The demographics of urgent care clinicians has changed quite significantly. 15 years ago, it was 70% physician, and now it's over 85% nurse practitioner and PA. And there is a difference in the training and the schooling that different clinicians have had. And with this being such a nurse practitioner and PA dominated workforce now, that background, that clinical training with medical school and residency is lacking in a lot of the clinicians who are working in urgent care now. So this is a great way to be able to up the ante, improve the quality of knowledge, the fund of knowledge that your clinicians have, and evidence-based urgent care is a great way to get everybody on the same page. Ending here with a quote from a respected member of the urgent care community. Evidence-based urgent care is a concise but in-depth review of urgent care presentations that can be problematic. It fills a much-needed gap in urgent care education, and we could not agree more. If you've got any questions, please reach out to Stephanie Williford, CEO of EB Medicine, and her email address is below. Thanks for your time.